about indirect sympathomimetics this time. Notice that it's the same campsite from before. See the adrenergic cabins? Good times, right? We can even see the same stage from that sympathetic summer talent show. Remember, the mime is a recurring symbol for drugs that mimic the effects of the autonomic nervous system. And because we're talking about indirect sympathomimetics, we see the stage indirectly, from behind. That prop bear kind of loses its effect, doesn't it? This sketch takes place out behind the campground at this lake, where a few of the scouts are trying their hand at fishing. For catfish, of course, because catfish is our symbol for catecholamines, which are epinephrine, norepinephrine, and dopamine. Indirect sympathomimetics enhance the action of endogenous catecholamines either by displacing them from the nerve ending or by inhibiting their reuptake or metabolism. Both mechanisms increase the concentration of catecholamines at the synapse. So let's sketch in a dock, and this dock will represent an adrenergic nerve terminal, where many of our indirect sympathomimetics will take action. But first, you can't just jump straight into fishing, okay? This is an intense sport. You have to first understand the intricacies, the theory. It's more complex than you think. So let's take a step back and first discuss adrenergic transmission at the synapse. Before synthesizing catecholamines, adrenergic neurons transport the precursor amino acid, tyrosine, into the nerve ending. This will be represented here by this tyrosine tire getting hauled up onto our presynaptic dock. See the scout handling the spool of rope? This dope rope will be a recurring symbol for dopamine. Once inside the nerve terminal, tyrosine is converted to L-dopa, hence the L shape of the crank handle, and eventually converted to dopamine. The drug metyrosine, a tyrosine analog, blocks the conversion of tyrosine to L-dopa, which prevents its conversion to dopamine. And look who stumbled upon his stolen set of tires. Camp counselor Mitch. And he's saying those are my tires, for metyrosine. What a party pooper, as he's blocking the synthesis of dopamine. In dopaminergic neurons, synthesis terminates with dopamine. However, in most sympathetic postganglionic neurons, dopamine is transported into the vesicle where it's converted into norepinephrine. Take a look at the end of the dock, where the scouts have prepared a fishing boat. This sea vessel will represent the events that occur inside the membrane-bound vesicle, before fusion and expulsion of neurotransmitter into the synaptic cleft. Manning this vessel is none other than our north compass-wielding norepinephrine scout from our previous sketch. We've included him here because dopamine is converted to norepinephrine inside the vesicle by dopamine beta hydroxylase. With increases in intracellular calcium, neurotransmitter is then released from the vesicle. So outside the boat, in the water of this catfish-infested lake, we'll depict the concentrations of catecholamines in the synaptic cleft. Synaptic transmission is discontinued either by diffusion of neurotransmitter out of the cleft or by reuptake of neurotransmitter back into the nerve terminal. Several medications used in the treatment of depression and ADHD inhibit this reuptake, thereby potentiating the levels of catecholamines and other neurotransmitters at the synapse. Let's sketch in one of our scout anglers depicting this catecholamine reuptake. A transporter on the presynaptic membrane, aptly named the norepinephrine transporter, or NET, transports norepinephrine and similar molecules back into the cell cytoplasm. The catecholamine net is represented by this catfish net, getting hauled up onto our presynaptic dock. See the sign, net dat catfish? While both norepinephrine and dopamine can be transported by NET, a dopamine transporter, abbreviated DAT or DAT, by which dopamine is cleared from the synapse. So NET and DAT are the targets of many antidepressants and recreational drugs, including cocaine. I don't know about you guys, but the cocaine of my childhood was, of course, hot cocoa. That sweet, intoxicating powder, it was like ground up, dehydrated dreams, reanimated by boiling water. Notice on the side of the dock, we've sketched in a negligent scout enjoying a delicious mug of this aforementioned cocoa beverage, and he's left his fishnet unattended. allowing the catecholamine catfish to accumulate in the water below. Cocaine is an indirect sympathomimetic that inhibits NET and DAT, causing the accumulation of neurotransmitter at synapses. Peripheral NET inhibition leads to sympathetic stimulation, which can manifest as hypertension, tachycardia, and mydriasis. Central DAT inhibition leads to increasing dopamine concentrations in the CNS, contributing to arousal, addiction, and the development of seizures. On an exam, the classic presentation of cocaine intoxication will be in a patient presenting to the ER, agitated, hypertensive, tachycardic, with dilated pupils. So just look at this scout here hopped up on that hot cocoa. Rapid onset of action can be obtained through injection, smoking, or snorting, and exam questions may include some highly suggestive findings, such as mucosal atrophy or even nasal septal perforation. See his bloody nose? That must be some pretty high-grade cocoa. These intranasal symptoms are caused by local ischemia due to the fact that cocaine is a potent vasoconstrictor. Its vasoconstrictive effects can also trigger coronary vasospasm, leading to myocardial ischemia. We've added a crown shape to the mug he's grasping, which should look like a constricted coronary crown. Also notice that our cocoa-intoxicated scout is clutching his chest, leaning against our recurring symbol for angina, this angina anvil. So remember, these patients may present with chest pain. And again, we've highlighted these vasoconstrictive effects by tethering our unattended fishnet to this anvil. Just look at those tight, constricted arteries. The management of cocaine intoxication remains supportive. However, it's important to remember to never give a patient beta blockers if cocaine intoxication is suspected. This can lead to unopposed alpha-1 stimulation and extreme hypertension. I mean, just look at this cocoa addict here, playing the beta-1 bugle from the previous sketch. Once that beta-1 is blocked, the alpha-1 pressures come to a head. And since we're on the topic of catecholamine transport inhibitors, I'd like to briefly mention atomexetine, a selective inhibitor of the norepinephrine reuptake transporter, NET. Its actions are mediated by potentiation of norepinephrine levels at synapses, and it's used in the treatment of ADHD. See the scout underneath the dock? He's also disregarding this unattended and overflowing NET, probably because he's distracted by this little TV with a mesmerizing atom on it. See what channel he's watching? ADHD. Get it? It's in HD. Well, anyway, atomexetine treats ADHD by blocking NET, a norepinephrine reuptake transporter. Alright, as I mentioned earlier, indirect acting sympathomimetics work not only by inhibiting neurotransmitter uptake, but also by displacing stored catecholamines from the sympathetic nerve ending. See those catecholamine catfish hauled back in with that NET? Well, next they can get recycled and stored in a membrane-bound vesicle, symbolized by our C vessel, of course. To get there, catecholamines are transported into the vesicle by the vesicular monoamine transporter, or VMAT. Notice that the catfish are being thrown onto this mat with V's indicating their path as they're being transported into the vesicle-like storage container. VMAT can be inhibited by reserpine. Not important clinically, but it may come up on an exam. Just think of reserpine as this reserpent water snake blocking catecholamine catfish storage, thereby depleting your neurotransmitter stores. These are catch and release waters, after all, so on the vessel, let's sketch in one of the scouts displacing the catecholamine catfish and throwing them back into the water. This ichthyophile depicts the actions of amphetamines. His shirt says it all. Fish are a friend of mine, for amphetamine. Anyway, amphetamine is important chiefly because of its use and misuse as a CNS stimulant. These effects are mediated through the release of norepinephrine and, to some extent, dopamine. Methamphetamine is very similar to amphetamine, but with an even higher ratio of central to peripheral actions. The amphetamines have a mood-elevating effect, which is the basis for its widespread abuse. However, after entering the CNS, amphetamines also have an alerting, sleep-deferring action that is manifested by improved attention to repetitive tasks. So that's why they're perfect for treating narcolepsy and ADHD. ADHD will be again represented by the distracting television, this time on the boat. And looks like the scout here is so distracted that his bucket of catfish are falling right back into the lake. Who cares? The new hit reality show, Friend Date, is on. Let Friend Date remind you of methylphenidate and the rest of the related amphetamine stimulants used in ADHD. Have you heard of Friend Date? I mean, I don't watch it, but I heard that Braden was voted into the friend zone? I mean, I don't care. Let's just move on. Anyway, narcolepsy will be represented by this stuporous scout who couldn't care less about the mid-season finale and is hitting the snooze button on his alarm clock. Take a close look at the alarm clock and you'll see that it's in sleep mode. The word mode should remind you of the drug modafinil, a stimulant that's approved for treating narcolepsy, with fewer adverse effects compared to amphetamines. Think of modafinil as getting you out of sleep mode. Okay, one more thing about amphetamines and related stimulants. These drugs also have an appetite suppressant effect. While they're not used for the sole purpose of weight loss, appetite suppression can be a useful side effect in obese patients. So let's draw on this completely untouched plate of dinner sitting here on the coffee table. I'm pretty sure Friend Date and Snooze Button over here aren't interested. You know, with all this talk about dopamine and dopamine transport, let's finish up this sketch by briefly discussing the activation of dopamine receptors. Dopamine itself is an adrenergic agonist that has varying effects based on the dose administered. Let's depict these dopamine receptors here at the dope rope swing. See how the S and the I of the swing are highlighted? These are the G proteins coupled with D1 and D2 receptors, respectively. Because D1 receptors are coupled with GS, they cause increased CAMP. This leads to activation of protein kinase A and smooth muscle relaxation. So at lower doses, dopamine stimulates D1 receptors in the renal vasculature, thereby inducing and increasing GFR, renal blood flow, and sodium excretion. On an exam, the increase in renal blood flow may be the single distinguishing feature of dopamine, as other pressor agents such as epinephrine and norepinephrine cause alpha-1 constriction of most peripheral vasculature, including at the kidney. Let this single rope swing represent the D1 receptor, and notice that there's a kidney at the end of the renal vascular dope rope to represent the increased renal blood flow. The only other thing you need to know about IV dopamine is that it activates beta-1 receptors at low doses and alpha-1 receptors at high doses. Just think DBA. So after D1 and that increased renal blood flow, increase the dose and you'll reach this beta-1 bugler. Keep increasing it and you'll find an alpha-1 candle-wielding scout, a shining beacon at the top of the dope rope. So think of those beta-1 heart-activating effects and alpha-1 pressure effects, and you can understand why dopamine can be used as a pressor in heart failure or shock that is refractory to other agents such as norepinephrine. But on the exam, just remember which receptors are activated at different doses. By the way, we've got our D2 receptor here as well, represented by a double-roped swing. It's a safer swing secured by 2 ropes for D2. You know these scouts though, safety first. See this brain helmet? It's to remind you that D2 will be important when we discuss dopaminergic transmission in the CNS, affected by antipsychotics in Parkinson's therapy. But that's for later, so stay tuned. Well, it's that time again. Let's sum up this sketch. Indirect sympathomimetics enhance the actions of endogenous catecholamines either by displacing them from the nerve ending or inhibiting their reuptake or metabolism. In adrenergic neurons, catecholamines are synthesized endogenously from tyrosine. Tyrosine is converted into dopamine, a step that can be inhibited by the tyrosine analog metyrosine. Dopamine and other monoamines are transported into the vesicle by VMAT, which can be blocked by the reserpine serpent. Dopamine is converted to norepinephrine in the vesicle. After neurotransmitter release, synaptic transmission is discontinued by diffusion or reuptake. NET and DAT are transporters on the presynaptic membrane that bring norepinephrine and dopamine back into the cytoplasm. Cocaine inhibits NET and DAT, causing both peripheral sympathetic stimulation and CNS effects. Remember those classic signs of cocaine intoxication, including agitation, hypertension, dilated pupils, mucosal atrophy, and chest pain due to vasoconstriction. And also remember, don't block that beta. Our amphetamine fish friend works by displacing stored catecholamines. After entering the CNS, amphetamines have an alerting, sleep-deferring action, and so they've been used to treat narcolepsy and ADHD. At our ADHD TV, methylphenidate is represented by the hit show Friend Date, while our narcoleptic scout hits the snooze button. Modafinil is an amphetamine substitute approved for narcolepsy. Think of modafinil as getting you out of sleep mode. And for dopamine receptors, just remember renal blood flow and the DBA order of activation. And look at that. I finished just in time. It's 6 p.m., so I've got to run. I've got a pretty special date that I don't want to be late for. So I'll catch you later.
Brayden has been in solitary confinement for the past week.
Brayden.
Will he ever make it out of the friend zone?
Totally deserve better than her. This is ridiculous.